There are a lot of disproportionate chronic illnesses that are found in African American communities at far higher rates than whites. And we're talking about diabetes, we're talking about high blood pressure, hypertension, cancer, uh, a host of illnesses that tend to surface in African Americans more than whites. And on top of that, you have socioeconomic factors, not the least of which being employment. African Americans tend to have jobs that don't necessarily grant medical leave. There's a lot of people who work in public facing jobs. Think retail, think restaurants, think bus drivers, think transit. A number of African Americans who have jobs that don't allow to work from home because of the aforementioned factors. They have to be present in order to get the job, and you have to be on the job in order to get a paycheck because many of these jobs don't necessarily carry with them medical leave. So that's layered on top of already existing health issues. And on top of that is an issue that not a lot of people talk about, which is how the medical community, how the medical industry sometimes discriminates implicitly against African Americans. There's been study after study that talk about how doctors don't necessarily take symptoms as seriously from African Americans as they do from whites, how pain management is different between white doctors and black patients, how African Americans are afraid sometimes or anxious about the treatment that they'll get from white doctors. So you've got layer upon layer upon layer of contributing factors. And what we have here is those layers they're falling away and they're exposing the very real structural bias that's built in to healthcare in the United States. A lot of this is systemic, but very much more of it is political. You have a chain of states, ironically and tragically, where 13% of the African American population lives. We're talking Texas, Louisiana, Alabama, Mississippi, Georgia, Northern Florida, North Carolina, and South Carolina. Those are a chain of Republican-led states that refuse to take the Affordable Care Act as an option. It's where a large number of African Americans live. It's also where a large number of poor whites live. It's easy to discount medical care in good times and when you're not the person who needs to go see a doctor. But if your health is on the line and you can't get to see a doctor, you're going to have to trace that decision back to your governor's decision to not accept federal money to broaden healthcare access.